Well, one of the things that we believe is very important in terms of selecting what treatment is best for each one of our patients is we see them in consultation. The first step is they come in and see us, they spend at least an hour with us. We work with them, determine for their type of cancer, what is the best treatment approach. In terms of selecting the best radiation approach, we ask ourselves some questions. What are the largest challenges that this patient will face? Is it toxicity related to radiation? And if so, what is the best modality to minimize the risk of toxicity? If it's proton therapy, we will recommend that. If the problem is inability to gain local control from a certain tumor because of the difficulty in treating that location without exceeding the risk of toxicity to a critical normal structure next to that tumor, and the answer is that proton therapy would give us the best ability to treat that tumor, to give it local control without violating normal tissues or giving the patient an excess risk of toxicity, then we will recommend proton therapy. But this is an individual decision that's made with each patient in mind. We talk about personalized medicine and precision medicine. This is just an example of it. About 50% of our patients undergoing radiotherapy will receive proton therapy. The number that we believe may benefit from proton therapy may actually be higher than that, but there are certain logistical challenges and limitations that our patients face, even if we believe someone should get proton therapy. I think a model-based approach where we can predict beforehand how we believe patients will do is a useful tool. I think in situations where the demand for proton therapy will far exceed the number of slots available, you have to make some decisions on which patients do you think will benefit the most. And if you have a model that can actually accurately predict that, it's a very useful tool to make some very difficult decisions. So can a model-based approach replace a randomized controlled trial? That's a difficult question. I think part of that is that a model-based approach, although very helpful, may not be perfect. Any model is only as good as the model itself and how robust it is or how many outcomes you're looking at, and it may not measure some outcomes that may be important. I do think it's a helpful tool. Randomized controlled trials also have their flaws. So no system is perfect, and I think that a happy medium may be to be able to use something such as model-based approach to select and identify patients that you think would be most befitting participating on a clinical trial. So I think there's actually room for both, and I think they can work together. There's a synergy there.